Hey folks, it's Dr. Mike here, and I want to talk about the 8 medical exercise training documents you must obtain and maintain in your clients' folders. Okay? Now, across the board, medical exercise training has changed the way fitness and personal training works. Now, instead of just simply working the client out and giving them a good sweat and they lose weight and they get stronger, now medical exercise training comes along and it requires now a higher level of service. So again, medical exercise training is the development of safe and effective exercise programs for clients with medical conditions. It does not purport to provide any aspect of medical treatment, therapy services, or diagnostics. It's just simply a good old exercise program for the client after they've been discharged from medical care. With that now, your responsibilities are actually higher because you've got to keep track of more things. So there are 8 forms that you need to keep track of. So you need to get these from the clients, have the client fill these out, and then maintain them in the client's folder and make sure with all of this information, you put it under lock and key so it's safe. No one can tamper with it. No one can copy it. No one can take a look at it. Only you can see it. So it's for your eyes only. And remember, all of the information that you document on your client is actually their property. You're simply the custodian. So let's talk about this a little bit. You need to make sure you have an intake or demographic form. This is the form the client fills out with their name, their mailing address, who to contact in case of an emergency. Also in this form, make sure that you note the client's physician, physical therapist, and or chiropractor record. Vitally important. Number 2, a medical history form. Now, most people just simply have a PAR-Q. I'm saying something beyond the PAR-Q. A medical history form that may have a number of questions on it. I mean, we're from 2 or 3 questions to 10 or 20 questions that are appropriate to ask any client coming into your facility so that you can make sure they're appropriate for exercise. These are general questions, general medical history questions with regard to, have you had surgery? Are you having any pain right now? Has your doctor ever told you have any cardiac issues? So these are general questions around the client's medical history, but please make sure with this form, you don't just simply give it to the client and let them fill it out. This medical history form should be an interview. So the form is used to conduct an interview. So you're literally going to ask the question of the client. The client will respond to your question. What we're looking for is the client that's hesitant to respond and then responds with a no. Now, stop and think about it. The client sitting across from you that you're conducting this medical history interview on is a client that says, hey, I want to exercise. I want to get stronger. I got this condition. I want to get better. And they're going to do anything possible to get in and get started with exercise. So it becomes important that you make sure they understand you need them to give you accurate information so you can develop a very safe and effective exercise program for them. We find in many instances clients will not give complete, totally accurate information because they want to make sure they can get in and exercise. So make sure you emphasize in the beginning with this medical history, this information that you're providing me will allow me to produce a better, safer, more effective exercise program for you, so please answer the questions accurately. The problem we've seen in the past with medical history forms, person fills them out, the client fills them out, we stuff them in their folder and we never look at them again. Then 2 or 3 weeks later, the client says, oh, I had a hip replacement and you are unaware of it. Well, they filled it out on the form, but you never looked at the form. So from this point on, these medical history forms are actually medical history interview forms. Maintain these. Next, a medical release of information form. This is a form that basically the client signs and dates. It's good for 1 year and simply is saying that you can now communicate with the client's doctor, therapist, or chiropractor. Now, most instances, you're going to have to fax this form over to the doctor, therapist, or chiropractor before they'll release any information to you. And just like I told you in the beginning of this video, you're the custodian of this information. This is actually the client's property, all of this information. The same thing holds true for the doctor, therapist, or chiropractor. They're the custodian. So before they release any information, they have to get a signed consent form from their patient, your client. So that's why we have them fill out the release of information form. A release of liability form, basically it says we're released from any liability with this exercise program. Well, many attorneys will say it's not worth the paper it's written on, but you need to make sure you have one. Medical exercise training screening form. We have a musculoskeletal screening we teach both in our PRCS and our MES course. It's a 4-page form, and with that 4-page form, it allows you to record the results of each of the 11 components of our musculoskeletal screening. You need to have some means of screening the client to make sure they're appropriate for exercise. Where you're looking for red flags, you're looking for any significant joint anomalies or movement anomalies that will tell you the client is going to have a problem. So we want to identify those before we start the exercise program, and these are done after the medical history is conducted. 6 on the list would be medical exercise training progress reports. You need to produce progress reports. If you're going to work with clients, you need to produce progress reports. And with these progress reports, you should every 30 days send out a progress report to the client's doctor, therapist, or chiropractor just to let them know what's going on. And if there's no doctor or therapist or chiropractor record, you at least need to do a follow-up on the client, a reassessment, and just simply write out the client's progress. That makes sense. 7th would be a MET referral or medical clearance form. Now, this is a form that's coming from the doctor, therapist, or chiropractor. This is just simply the referral form. And the medical clearance form will be a form that basically says the client is cleared by their doctor to begin exercising. We want to make sure we maintain that on file. And then lastly, any type of training agreement or contract that the client signs where they agree to the number of sessions, the rate, and all the other components of the business arrangement that you have. Now, these are 8 forms that you must maintain. Again, you move beyond personal training now. At this point, you're now maintaining these forms because we need to have a record of what you're doing with the client. Now, of course, and I haven't mentioned it here, we do need to have some type of assessment forms. Now, we offer a medical exercise training forms bundle. If you go over to www.metforms.com, we offer some, I believe it's 21 or 22 forms. That includes assessment forms for different areas of the body, screening forms, all the history and other administrative forms that we mentioned here, because we realize now for medical exercise trainers out there, or medical exercise specialists or medical exercise professionals, you now need to make sure that you put all of this stuff in writing. It's vitally important because you've got to communicate with doctors, therapists, and chiropractors. You've got to maintain this information, and you've got to maintain it in a secure area. So it's under lock and key so that when you're not in the file, it's locked up someplace so no one else has the ability to go in and review that file and get very sensitive information on your clients. So again, if you want to get more forms, go over to www.metforms.com. We've got a forms kit. We'll even personalize it with your contact information at the top of the form and your logo. So just simply go there, get more information. We also in the future will have a documentation course so you understand how to document the client's progress, how to document training sessions, as well as how to document the assessment process. Again, medical exercise training is not designed to take the place of physical therapy, chiropractic care, occupational therapy, or medical services, but it's here to stay because we're seeing significant reduction in reimbursement for rehabilitation services. These clients are now still not fully functional. They need some place to go to receive a safe and effective exercise program, and it's incumbent upon you, the medical exercise professional, to be able to communicate with their doctor, therapist, and chiropractor, maintain this information so that now we have a clear picture of what you've done with the client. So again, if you want to get more information, go over to metforms.com or go over to postrehab.com. If you have more questions for me, please email me at drmike@postrehab.com. And in the next couple of months, we'll offer a documentation course for medical exercise professionals. So please periodically check back on our website, postrehab.com. Again, thanks for watching. Best wishes in building your medical exercise training practice. And if I can answer any questions for you, please email me. All the best.